Well, good morning, everybody, and thank you for joining. To those of you that are gathering on the WebEx, and those of you that will be watching this in the future on recording in any on-demand fashion that you so choose. We are very honored to have with us a team of authors of a recent report from the IBM Center for the Business of Government, who have written just a seminal work on lessons learned for government management during the response and recovery to COVID-19 and what this indicates in terms of their role in the future. I'm Dan Chennock. I am the moderator of the session and the executive director of the IBM Center for the Business of Government. Many of you are familiar with the center. We are essentially a think tank inside IBM. We work with academic experts and nonprofit experts like the leaders that we'll hear from today, who do research on topics of interest to government leaders in the US and around the world, and develop actionable recommendations for government action in a number of different areas. And our topics of research range from broad management discussions like the one we'll have today to more issues that are more technology oriented, public-private partnerships, financial management, the range of issues that would affect a chief in any agency, whether it's a chief information officer, chief financial officer, chief operating officer, or program leader, or other leaders or teams working to implement government programs. Today's program is all about the recent report we did that was authored by our first three speakers. The report is around 12 principles and action areas for dealing with viral uncertainty. And you can see the link to the report. We'll put that in the chat for those of you that may not have seen it previously. But it continues the center's tradition of stepping back from major events, major crises, major points, focuses of opportunity in the past to see what can one learn from these events and what can government take forward to ensure that it's better prepared for responding and recovering to similar events that may occur in the future. The center did a piece on the Recovery Act that was actually written by Ed DeSev, who's now a visiting fellow with our center and was then the leader of the Recovery Act. In this vein, also did reports on the H1N1 virus and its impact, the Ebola virus and its impact, and others in that vein. And this report is part of that tradition of sort of major findings, major research areas. I will note, just as a housekeeping matter before we get into the substance, we are in a webinar mode. Feel free to use the chat to make comments or ask questions. I will be monitoring the chat, and we'll have opportunities for interaction with you during the session in that way. Otherwise, just take notes and feel free to follow up, of course, afterwards. And as we post the event, feel free to share. We'll share with you the link, and you can share with your teams or colleagues who may not have had the opportunity to join us today. So we are first joined by the three authors of the report. They are Don Kettl. Don is the former dean and emeritus professor at the University of Maryland. Don has held more positions and written more about public management than possibly any other scholar in the world. He is a noted mentor and a leader among both government and academia and industry leaders who are interested in learning about government management and sort of understanding the deep research and intellectual strength that he brings to the arguments in the works that he does. So thank you, Don, both for authoring the paper and for joining us today. We are also joined by Rich Greene and Katherine Barrett. Rich and Katherine are two of the most noted commentators on state and local management issues in the country. They have written for a large number of publications. They've written for our center in the past, including an interesting report they did for governors who are entering a new transitional state as they enter office, which they wrote a number of years back. They are also principals at Barrett and Greene, Inc., and lucky for us, visiting fellows with the IBM Center for the Business of Government, where they blog and write on topics of interest occasionally. After Rich, Don, and Katherine talk about their report for a sort of a brief summary and walkthrough, we'll have the opportunity to have a discussion among the three of them that I'll join, as well as Dustin Brown, who will act as a discussant in the discussion. He'll be sort of the first commentator after their session. And Dustin is the Deputy Assistant Director for Management at the Office of Management and Budget. I'm sure many of us have followed and worked under guidance that Dustin has authored. He is a great partner to both our center and the broader management community in so many ways in the U.S. government. I'd also point out that Dustin is the chair of the I think it's the Public Governance Committee, I may have the title wrong, at the Organization for Economic Cooperation and Development in Europe. So Dustin is really a global force in terms of helping governments move forward in understanding how to apply management techniques to improving the performance of their agencies and bureaus in their own countries and making comparative studies there. So Dustin, thank you for joining. And then after a discussion and question and answer, we'll close hearing from Tim Pados. Tim is the general manager for the global government industry team at IBM. He basically oversees all of IBM's engagements with governments around the world, leads a team that kind of makes cross pollination around the world in terms of what governments are doing in one country, how we can bring those lessons to governments in other countries. And Tim has been leading a series of blogs and articles that have taken this look, which Rich and Katherine and Don's paper really looks primarily at the U.S. with some implications for other governments. And Tim will help us bring that to the world and sort of bring in what's happening around the globe and close with an understanding of how the discussion today really matters for countries, regardless of where they are in their journey to respond, recover, and emerge stronger and more resilient as a result of the experience of going through the events of the last 2 years. So thank you all to all of our speakers. It is now my honor, I believe I'm turning it over first to Katherine, Katherine and then Don and then Rich, and they'll each kind of talk for a few minutes about the report. So Katherine, over to you.
Dan, thank you very much. It's great to be here. So I wanted to say just something to start with about how we are going to do this. And, you know, when we sat down to think about the lessons that could be learned from the pandemic and how those lessons could be applied, not just to future pandemics, I hope not, but also to crises generally, we came upon 12 ideas, 12 basic principles. And, you know, that's a lot to get your arms around. So what we did is we took those 12 principles and we kind of saw that they fit into 3 separate groups. And that works out very nicely for today because there are 3 of us. So I am going to talk about the first group, which has 4 principles in it. And it's really all surrounded with the idea of building partnerships. And just as an aside, that idea of building partnerships really that should happen well before any crisis begins. It should happen all the time. It's fundamental. But within that broad group, the first principle really recognized the idea that crises start out as local events, and that's true of practically every crisis. It hits somebody first, but local responses vary really dramatically. And of course, we could all see this in the pandemic. If you just accept the idea that the states and local governments are going to handle this themselves, you get a crazy patchwork of policies. So Rich and I, we've worked together for zillions of years.
We are married.
Yes, we are married. So that's why we're sitting together in our own dining room. That we really have a great respect for the autonomy of state and local governments in normal times. But the pandemic called out for a cohesive response and not for kind of a go it alone federalism. It needed the federal government to take a strong role in developing strategy and coordinating what was happening, because crises don't respect borders, and one community's problems quickly become every community's problem. You know, there were certainly ways in which the federal government did take that role. Operation Warp Speed stands out. The development of the vaccines, the marshaling of the private companies, had a terrific result for everyone. that was great. I mean, and when you look at the development of past vaccines, mumps, the previous fastest development of vaccine was 4 years. So this was really extraordinary. But otherwise, the federal government took a kind of a back seat, a hands-off response that let many state and local governments deny the existence of the pandemic and to ignore and sometimes even attack the public health advice that could have saved thousands of lives. Our second principle is very much attached to the first, but if you are going to coordinate action, if you're going to develop policies, it doesn't really matter what you do unless you get the local support, because local governments, state and local governments implement those policies. And for that, you need buy-in. And that really depends on strengthening and nurturing partnerships and having clear intergovernmental understandings, and also an understanding of what the roles are of different governments. And there are some really good examples of how that fell apart in the response to this pandemic. I said that the Operation Warp Speed, and that was great, but the initial rollout of the vaccine really had a lot of problems to it. And part of the problem was that there was a lack of understandings of the role of counties. And counties are really the major public health arm of the nation. And yet when the CDC developed its kind of playbook for how this would operate, when it did this in October of 2020, it practically left counties out. And many states were no better at dealing with, the understanding the role of counties. We talked to county executives who, in large states, and counties that were larger than some states, and the only way they were finding out about what was going on was by turning on the television and listening to their governor's press conferences. They weren't told about this in advance, told about the plans for the rollout. So the third principle is also really attached to this idea of communication. What we really felt was that governments need a language to talk about a crisis and to talk about crises in general. And the language really comes down to data. The questions about the pandemic could have been much more effectively answered if there were better data systems. And the federal government just did not create clear, intelligible data systems to track the pandemic. And those systems were badly needed. So, what was missing? Definitions of what the data meant, consistent methodologies, consistency in labeling, even when COVID-19 was responsible for a death. The definitions, the way that was approached was different in different states. Data about testing, and also national standards about the data that was needed to understand the demographics and what populations were most affected by the pandemic. Luckily we had Johns Hopkins step in and provide kind of magnificent data and analysis, but there was still, it still left many holes, many local governments, state governments really going their own way and not collecting the data that was needed. And the last, in my area, the kind of the building partnerships area is the fourth principle, was a recognition that just as in war, emergencies are fought with goods, services, and logistics, and wildly varying state and local approaches could not handle the multiple supply chain issues. They could not face them on their own. And anyone observing the pandemic knows that from the beginning, the shortages of equipment were just terrible. Hospitals, nursing homes, didn't have the protective personal equipment they needed. They didn't have the medical technology they needed. Nurses were, dressed in plastic bags because they couldn't get gowns. Essential workers were on the front line without the personal protective equipment that was needed to support them. The abdication of the federal government really contributed to a situation on which there was unnecessary competition and rising prices. The Associated Press labeled purchasing and contracting in March of 2020 a fragmented procurement system descending into chaos. So what we saw is that large-scale crises require large-scale mobilization. Coordination was needed, but the federal government declined to step into that role, with the president instead blaming the states for not developing their own stockpiles. And now I will turn this over to Don Kettl for the next group that we are talking about. Don?
Thanks so much, Katherine. And let me say just what an incredible delight it's been working with both Katherine and Rich, who by any measure are the people in state and local government in the country. And in addition to that, to have the opportunity to work with the IBM Center, which has been sponsoring truly cutting edge research. And so from my point of view, having that combination is something that could not be beat. What I want to try to do is look at the second piece of this, which has to do with managing networks, and explain why that's important. In a lot of ways, people talk about networks as if, well, of course things operate by networks, and people quickly embrace that as the inescapable element of all of this. But the challenge here is that in addition to the idea of managing networks is the problem of trying to sort out responsibilities. And throughout the entire effort to try to deal with COVID, there's been a just absolutely ginormous tug of war between those who argue for more responsibility with the federal government, those who argue that it ought to be put in state and local hands. A lot of the political challenges and ultimately the problems of trust in the entire system has been really put through the crucible, and in some cases the steamroller of efforts to try to sort out responsibilities. And one of the things that we want to argue is the primarily important piece of the way in which networks operate is that the effort to try to sort out responsibility and to say the federal government ought to be in charge, state and local governments ought to be in charge, that it's a global issue that pushes things in a different direction. The more that you try to assign a clear set of responsibilities to one entity to be in charge, the further you are from reality, and the more that you really wade into what's really a hopeless search, because no government can go it alone. And that's the evidence that we have not only here from the United States, but also from the United Kingdom, from Germany, and other countries that have struggled with the same kinds of issues. There's a mega temptation to try to sort out the issues so that somebody can be in charge, so there can be command and control. So you have somebody to blame, so the reporters have somebody to interview. That in many ways there's been this search, this paradoxical search for an effort to try to understand a way to try to put somebody in charge so that somebody can have the finger pointed right at them, and conflicting with the reality that the operations of a system, of a problem, of solutions as complex as those dealing with COVID simply make impossible. There really are four basic points here in our report that deals with the questions of managing networks. One is the problem of expertise. The second is the possibility of using new techniques like artificial intelligence and predictive analytics. It's the essential issue next of dealing with managing risks, and then the problem of trying to think about how to deal with the issues of networks. This issue about expertise and talent is something that is tremendously important, in particular because of the hyper-politicization of COVID and the effect that it's had in the public health workforce. And we've been discovering since 9/11 and long before that there are so many issues that require expert advice from people in the public health community. And it turns out that it's been difficult to not only organize, but also to maintain. More than 250 local public health officials have left their post by the spring of 2021. And this is important not only in its own right, because it means that the expertise in the system has been leaking out, but also, as Katherine pointed out, counties in many ways have been the unknown soldiers of the war against COVID, and the primary people in the counties responsible for this have been the public health officials. So that the more that we have problems with talent draining out of the system, the more we have challenges for trying to figure out how to try to make this work. Expertise itself has been politicized, and that's challenged the ability to try to find ways of getting people who can be both brave enough to do what needs to be done and expert enough to be able to provide the advice that's needed. One of the things that, for example, that stands in stark contrast to the American experience is the willingness of the Germans to trust the experts. And this underlying question of trust is a recurring underlying theme of much of what we write about. How do we try to deal with this talent issue? And we believe that a big part of the problem is that we simply have to grow their own, and that the public health folks in particular need support to be able to ensure that when the inevitable next crisis comes, that there are people in place who know how to do what needs to be done. We sometimes also have to deal with what a friend of mine, Swiss expert Danny Berkeley, said, that we have this delusion of competence that surrounds us as well. The fact that, well, we really know what's going on, or we're told what's going on, and we tend to believe it. That tends to be filtered through the echo chamber of ideological lenses that in many ways makes the application of expertise that much harder. We also need new strategies to try to build expertise. And one of the things that we discovered along the way in this case was that artificial intelligence and predictive analytics can really have a powerful, powerful role in trying to shape this. Not only do we have the evidence from what's going on at Hopkins and the kind of work that Beth Blauer and her team has done there, but also Chris Murray's work at the University of Washington. The ability to be able to predict, given current trends, what likely trends in cases and illness and deaths are likely to be, and the ability to be able to use predictive analytics in that way to try to model the future in ways that allow us to prepare for better responses. And one of the things, if you stop and listen to the underlying pieces of what we're talking about, is the recurring issues of trust and how to try to build trust in what it is that people are saying and how they're saying it and what to believe. But there are also these tugs of war that happen back and forth between those who want a system that's more decentralized and a system that's more centralized. And it turns out that the more you talk about issues having to deal with artificial intelligence and predictive analytics, we're dealing with issues that in fact are implicitly centralizing, trying to draw the keen efforts to try to instill advice into higher level officials, compared with the role of public health officials, where that's inherently decentralizing. And so we have these tensions that are built within this, which then leads to a fundamental problem of trying to deal with the issues of risk management. This is one of those things that the IBM Center has worked very hard on for years now, but which has come to the forefront with all of what it is that we've discovered with COVID. Because it turns out that in terms of risk management, there have been enormous political pressures to nudge the data, to try to push recommendations in certain ways, to try to deal with issues of lockdowns at the local levels, about how many bars to allow to be open, what the capacity of restaurants ought to be. And the question of risk management is inherently part of all of this. And what's happened is that the issue has become much, much, much sharper in terms of those issues and conflicts. In addition, there's been a temptation to ignore black swans, the high risk, low probability events that most politicians assume just won't be their problem, which then creates an incentive saying, well, it's not going to happen on my watch, so I'll be able to pass it along. In the end, what we believe is that networks are the key, but they don't spontaneously emerge and don't run themselves. Networks just don't happen spontaneously. So what this leads to is some big takeaways, I think, for this section about managing networks. That efforts to sort out what it is that ought to happen, but who ought to be in charge of what, is a fool's errand, because networks inevitably are the key to what happens. That the challenge of trying to make these networks work, however, is that we have a talent shortage that threatens to become an even bigger challenge, not only for the current crisis, but future crises that are inevitable. How are we going to get people who are smart enough to try to provide the evidence and the guidance that we need? It's the need to bring risk into the equation and to deal with the mismatch that happens with those who argue for the long-term implications and the short-term political horizons that inevitably are here. And the notion that networks don't spontaneously emerge, they need to be nurtured and led. So we have underlying this, these tensions of centralization and decentralization, of expertise and political judgment, and the time horizons that turn out to be very different for the people involved in this process. Put this all together and helps to explain why it is that the system has become so incredibly complex, and why it is it's been so hard to manage the issues of COVID, and about why it is that we need to think very carefully now about these ongoing lessons for the future, which leads me to try to toss this to Rich, who has a whole series of issues about steering outcomes, and especially making sure that we pay attention to the issues of equity.
Well, thank you so much, Don. We wrote the piece together, and I learned new things listening to you talking about it just now. And just to reciprocate in great sincerity on both of our parts, the two of us, as Katherine said, have worked together for a million years, and never really wanted to collaborate with anybody very much except for one another. Turns out that now we want to collaborate with Don and everything else we ever do, because he is the smartest, sharpest guy we know, at least among academics. Don mentioned the category I'm going to be dealing with is called steering outcomes in the report, and these are all aimed at providing information and guidance as to how to advance government efforts to make progress and to get better results. That word "results" is always kind of a critical thing. The first one of the four categories harks back again to something Don was talking about, which was solutions to all crises require trust in government. We could think now, by just reading the papers, that suddenly we've lost faith in government because of the things that have happened during the period of time that COVID has been among us. That's not true. People haven't trusted government for a long time. I suspect since the founding of the Republic, certainly the little bit of data we have is that since 2007, according to the Pew Charitable Trusts, only 30% of the population either believes that they can trust government some of the time or always. And the other 70% think there's a decent amount of likelihood that we're not going to be able to trust the government and what it says. We've seen this in the papers, and again, not to do with COVID, but when there are floods, you always read in the papers about how people say, the government, the local township, the community say, evacuate, it's dangerous here. People don't evacuate and people drown because there's lack of faith that the government is telling them the right thing to do. They think this is just sort of a persnickety way for government to intrude. So in crises like this, the lack of government, faith in government can really lead to unfortunate consequences. Although I've made other references, I think there's probably not been, at least in my lifetime and in recent history, an instance in which the lack of faith in government has led to more deaths and more disease. And social media, I could go on about this forever, but social media has not helped. It's hurt. We came across in doing the report a 14-minute video on Facebook. And also, I guess it was on Instagram back in January. It was so persuasive. 5 reasons why vaccines were dangerous. Well, it was very persuasive, but it was very wrong. I mean, it was very untrue. The science didn't back it up. Nothing backed it up. But nonetheless, when we looked, it was getting hundreds of thousands of views. And even if only a small portion of those hundreds of thousands of people viewing actually believed it, that was a very dangerous thing. And at heart of it was, don't trust what the federal government, don't trust what your states are telling you. We're telling you the truth here on social media. I can't help but think about an anecdote that I heard a long time ago in talking about government. And the reference was, if Pepsi-Cola and Coca-Cola both had ads up, and Pepsi-Cola's ad said, Coca-Cola poisons you. And then Coca-Cola said, Pepsi-Cola kills young children. Nobody would drink either beverage. And this is part of the reason for the lack of trust, we believe, is that there has been such partisanship, such snipery, such nefarious attacks among and between elected officials that if they don't believe each other, it's hard for the public to believe them. And that's how, unfortunately, politics is played a lot these days. And some of the most effective remedies were those taken in states that brought in trusted spokespeople instead of the elected officials to speak to the community. It turns out that that experts who the community knows and is aware of as part of their community tend to be more persuasive. The second of our 12 principles that I want to talk a little bit about, we worded it that experiments in laboratories of democracy are great, but they're worthless without learning. Most of you are probably familiar with Judge Brandeis, the Supreme Court Justice, who talked about the states were laboratories of democracy. There was a book by Osborne some years ago called Laboratories of Democracy. My understanding was that President Clinton actually slept with it by his bed before he became president. Don't know that he read it, but it was certainly by his bed. And that's a great idea, but the results from laboratories don't do any good. Any chemist could tell you this. The results from laboratories don't do you any good if people don't learn from them. So that, for example, the interstate highway system would never have functioned and become what it was if each state had planned on its own model with its own unconnected roads and different signs and different signals and different height bridges. The experimentation in each of those states could be a good thing, but if other states didn't learn from one another as to what was the best way to do it, then the laboratories of democracy would not be a functional thing. There's a strong example, I think, in the report. Seattle and in King County, which had one of the nation's highest death rates in March 2020, tried early and aggressive shutdowns and measures and other steps like mandatory masking. It drove its COVID rate lower than any other large metropolitan area in the country. And other cities pretty much just ignored the outcomes that were happening in Seattle and King County, and it was clearly to the detriment. There's hope here, and if you read the report, you'll see each of these 12 principles is accompanied by an action item, which are our ideas based on research as to how the things that we're complaining about can be fixed. And in this case, the governments at all levels can develop a more sophisticated approach that views federalism on a continuum between national control and local flexibility. And that can then determine what kind of crises call for what kinds of action. The third one I want to talk about a little bit is inequities. And people talk about a more equitable society. The pandemic may have been the most single petri dish, you could think of it as, that exposed the bacterium that have riddled through our country since Reconstruction. Part of the problem comes from deeply rooted inequities in healthcare, and comes from the fact that many state governments didn't even keep track of the impact of COVID on minority populations. The data that we've talked about a little bit before, the data being the sort of the language with which we communicate, simply wasn't there. We weren't aware early on that communities of color frequently had far worse outcomes than other communities. Of course, the people in the communities of color, they knew that their neighbors were dying. They could tell, but the population as a whole wasn't aware until a ways into it, when, thanks to, as I think Katherine mentioned earlier on, Johns Hopkins started to do some disaggregation, started to show what was going on. We became aware of this as an issue. It turned out that Black people relative to white people were more likely to live in neighborhoods with a lack of healthy food, with lack of recreational facilities, lighting, safety. And these neighborhoods are kind of rooted in the historical legacy of redlining. Additionally, Black people in America tended to live in densely populated areas, which heightened their possible contact with other people. Downtowns of big cities, which as time went on, actually those areas improved in terms of the outcomes that they were seeing with COVID. But in the depths of the plague, that was a really bad thing. I'll give you just one more interesting example that doesn't really have to do with COVID, because again, our report is directed at crises of all kinds, not just COVID. There was a giant heat wave, you'll recall, hit big parts of the country, including places you wouldn't expect, like the Northeast and the far Northwest. So in Portland, Oregon, the heat wave hit that was hit up to 120 degrees in some parts of the city, and there was a researcher who went around with a fancy thermometer, took temperatures around the city, and discovered that the wealthier neighborhoods, interestingly enough, and sadly enough, were way cooler than the poorer neighborhoods, the neighborhoods in which minority groups tended to congregate or to live. And that was because of trees. The wealthy neighborhoods had a lot of trees, and it kept things cooler. And the poorer neighborhoods didn't have so many trees. And when you saw in the papers, if you read about this terrible calamity, killed a lot of people, it turns out that when they talked about it reaching 120 degrees in Seattle, the 120-degree temperatures were really not in the wealthy neighborhoods; they were in the poorer neighborhoods. That's kind of a very sad thing. And I guess the last thing I want to hit upon is is accountability. Accountability is just sort of what it sounds like, but the problem is that complex problems defy accountability because they go beyond the capacity of any organization to fully understand what the problem's cause is or how best to solve it. Things become more complicated when there's disagreement about the exact nature of the problem. And this was an issue early on. Was COVID, should people be held accountable for making sure that the economy springs back, which meant that you should probably keep your stores open and keep your movie theaters open and keep the arenas open? Or was it really a healthcare problem? If it was a healthcare problem, we were holding people accountable for that, then we should be keeping people out of large places. We should be closing down the arenas. We should be closing down the schools. So if you don't know what the mission is, if you don't know what the goal is, it's very hard to hold anybody accountable for it. The key in attacking the dilemma of accountability riddles its way through the entire report. We need stronger partnerships between levels of government. As well as I mentioned earlier on, better data so that we can hold people accountable based on performance measurements, which is an area that Kath and I have written about for the better part of the last 30 years. If you can't measure success and you can't measure failure in a legitimate and in a fair-minded way, there's no way to hold anybody accountable for anything very much. It becomes largely a political exercise, not so much one based on information. And with that, I'm gonna be quiet. I know I might have gone on a little bit long, but I really love this stuff. And the three of us are now going to have a conversation, reasonably spontaneous, I think. And I think I'd like to start, if I could kick it off by asking Don a question. There have been a lot of complaints from one level of government about another. Should we focus on how to sort out the roles, or is that an impossibility?
I think it's not only an impossibility, but it's something that even if you tried to do it, it couldn't be done. It wouldn't be wise to do it either. On top of that, there was just so much of a tug of war back and forth between the federal government and state governments, between state governments and the local governments. And we had a lot of extra cost in the system. There were lots of friction as the governments were just fighting with each other about that. If there's anything that I think we've learned about this, it's that the system works best if people focus on outcomes and not processes. That is, what can we do to try to make people safer? What can we do to try to immunize them to prevent the disease from spreading? What can we do to try to ensure that people can get back to work and have a chance to get their kids to school? That the more that we, and this is a great overriding lesson, I think, that the more that we focus on what it is we're trying to accomplish and how well we're doing it, the easier it is to hold the entire system accountable. But we have to look on this as the need to try to integrate the different pieces. And I want to sort of flip this back to both of you with a question of, is this just hopelessly depressing? I mean, is there hope in all this? You could listen to some of this stuff and you could listen to us and conclude, wow, what a mess this is. And the deeper that you dig, it's even worse than we thought. Is there reason for hope in all this? And I'm an optimist, but I'd be curious to hear what both of you have to say.
Yeah, and I don't know. It feels to me that one of the keys here is solving a lot of these problems before the crisis hits. I mean, I said that before, but I don't know, in looking at state and local governments and federal government through the lens of intergovernmental systems, it's the intergovernmental systems that have really always been the weakest, and that's what needs so much bolstering so that you can deal with the crises when they happen, so that you have the relationships already there to support, you know, a world in which you're not like this, you know, at each other's throats during the crisis.
So, Catherine, is what you're saying that you are optimistic, that you think that we've learned enough lessons that I mean, this report is going to be read by a few people out there. But beyond that, how are we going to learn the lessons from this to move forward? Are we focused enough on that kind of thing so that we have room for optimism?
You know, I'm always kind of optimistic, but maybe yes, maybe a sense that we need to pave the way to prepare for the next crisis in doing things that are more basic. I mean, even in the idea that you were talking about, you know, the terrible racial inequalities in the country are bad for everyone, not just for the people who are being treated unequally. And if you don't solve those in advance of a crisis, then it's going to cost more and take more to deal with a crisis when it happens.
And I'll buy that. And in terms of the principle about inequities, we've seen a whole bunch of communities in this country for the first time in history having chief equity officers. This issue has become of such a great consequence that we have people assigned the task of creating greater equity. We've also seen something that Kath and I have written about called equity budgeting, which is a spreading notion in the budgeting arena to make certain that not just is money fairly spread around the wealthy parts of the community, but fairly spread around the entirety of the community. So Don, I want to come back to you in terms of inequities. Just to hold on to that one for a second. How optimistic? We keep using the word optimistic. I guess we want to talk ourselves into it. But how optimistic are you in terms of improvement in what is currently an inequitable society that's been hit hardest by COVID?
Yeah, and I think that's such an important point, because as you start looking at these issues of equity, there are two things that come screaming out of our experience. The first is that in the early stages, there was relatively little attention paid to the relative distribution of the problems depending on racial groups and depending on income. And one of the things that changed that was the Hopkins data set, that the folks at Hopkins went out and identified not only the distribution of the virus by racial groups, but who was counting it, so we would actually know the answer to the question. And the answer to that was, it turns out not many people were, not many states were, but by trying to galvanize that from the from outfits like the Johns Hopkins folks who monitored COVID. We discovered through a kind of process of naming and shaming the states that were doing it and the states that weren't, in a way that really in the end forced just about everybody to start doing it. So I think that sensitivity grew as time went by. And then one of the other implications is that I think the Black Lives Matter movement tended to surface in the middle of all these debates and put more attention on the differential ways in which communities treat different people of different racial groups and different incomes. That I think is a lesson that will stick, so that there's at least a new lens through which things that happen in the future will be viewed. We got a long way to go to solve the problem, but I think we've made progress, at least trying to make sure that we ask the questions and make sure the questions don't go escaping every time something big happens. And that's at least something that I think is going to stick. And the more that we work on it, the better off we're likely to be.
Okay, I think just in terms of the aftermath of the crisis, if there is an aftermath yet, that the American Rescue Plan Act so much emphasizes equity in the distribution of the funds. I mean, equity and transparency and the things that you would really like to see across the dealing with the crisis.
And my guess as well is, just to be slightly less optimistic for just a quick moment, is that there are parts of the nation in which inequities are more riddled into the system in a deeper fashion than others. There are places that are more ripe for improvements in the kind of ways we've been all discussing and all kind of agree on. And I would not anticipate seeing a 50-state wonderful future in which we've eliminated all inequities and all men are created equal, but we all really believe it instead of just saying it. And I should now say all people are created equal. I can get into trouble with all men are created equal. So I think that's something that we need to watch out for, is that we see different things happening in different parts of the country, and that's really the whole one of the major thrusts of our of the report, is that we have not had 50 states function in 50 different ways, and you can't expect any of them to necessarily follow the route that any of the others have been.
Yeah, that's such a tough problem. But I think before we toss this to Dustin and get his feedback on this, there's one last question that I want to raise, because I'm basically an optimist on things. I think we've made progress in some ways, and some of these lessons are not going to escape easily. But one of the things I'm most worried about is the problem of trust. The fact that whatever trust that we had in government beforehand has been eroded a bit, and that expertise in particular has been politicized. And that was something that has been, I think, a dramatic, perhaps the most worrisome dramatic implication of what's happened with COVID. And my question is, since trust is so important, what do we do about that? Is trust now irretrievably not so much broken but politicized? Is there something we can do to try to think about the role of experts in society?
I don't know the answer to
Notice
this.
I asked the hard question and stepped back out of the way to push it to you.
But the power of the internet to distort information was absolutely, I mean, a huge problem during the pandemic. And you just don't know how, but hope that as we all become kind of more sophisticated about dealing with this new element in all of our lives, we will figure out how to pinpoint and control the misinformation that's out there. I don't know how.
Yep. Tough
There's
issue, Rich, and then we'll
thing.
toss it to Dustin.
Yeah.
Now, Rich, I knew you had a point that you wanted to make.
Yeah. Well, I just wanted to say one sort of wrinkle out of trust is that the lack of trust has created yet another major problem that we do point out in the report, which is the need to grow expertise, and the fact that that people haven't been trusted. The example we use was in Riverside County. The chief medical officer there was stunned at the backlash he received when he imposed lockdown orders. Citizens confronted him in a county board meeting, and they accused him of infringing on their rights and trampling on the Constitution. That was the phrase they used. And you can't really expect when men like him who rely upon the trust of the public in order to do his job well, are being attacked and criticized and critiqued. And actually, there was a fake Twitter account that featured his picture with a Hitler mustache and a caption of "Führer, Kammer and Kaiser." That was the name of this poor gentleman from Riverside County. So I think that one of the other wrinkles out of the lack of trust is that if you don't trust government, I don't see why you and Dustin, this is maybe a perfect segue to you, because God knows you. I mean, you are government. We just write about it. Trust, it just feels like it's very hard to do your job if people are going to discount whatever you have to say. And now Don was about to shift over to you, and I'd like to as well.
Yep, absolutely. This would be terrific. And Dustin, your thoughts on this would be invaluable. But as we switch to Dustin, let me remind everybody that in the chat box that there are lots of ways to be able to continue the conversation too in the sidebar, and we'll try to respond to as many of those questions as we can. Just send your comments to all attendees in the chat box. But first and more important, Dustin, what do you make of all this?
Thanks, Don, and to Richard and Katherine as well for the discussion and really the thought-provoking report. I definitely enjoyed looking through the principles and the insights you gained from your research, and I really appreciate the ability to look at multiple levels of government and synthesize from across those. I think people that have that perspective are rare and really, really valuable, given no single organization can achieve the kinds of outcomes that the public expect. And so it's going to take us all working in partnership. Yeah, as somebody kind of on the inside of government, this kind of gave me an opportunity to take a step back too, based on your work as well as my own experiences, and kind of synthesize a little bit from what I feel like we have learned and what are the key questions going forward as we try to become even more prepared to not just meet the moment, but also anticipate, as you all mentioned, future, pandemics or crises or situations that will inevitably come, and how do we learn from this and continue to build up the capabilities, the expertise, the knowledge that'll be critical to enable us to move forward. So I really had three that I'll just kind of run through quickly, and I'll try to include an example of something that's happening now that illustrates the broader point I'm trying to make, if that's helpful. The first kind of takeaway I have is I think the pandemic has really, and other crises too, for that matter, have really raised the question of how do we optimize horizontally across government? How do we make sure that the kind of traditional silos of government aren't getting in the way of the whole of government solutions that are often needed to deal with a crisis? And I think that this crisis in particular taught us that. In particular, one example of that is the U.S. government has stood up a President's Management Council, which includes all the deputy secretaries or chief operating officers of all the largest 24 agencies. They set up a working group on reentry and the future of work that serves as the primary interagency convening body for getting agency feedback and resolving questions on post-pandemic reentry policies and what the work environment will look like as we try to begin to safely return to the physical workspace, as well as connecting on post-reentry workforce planning as we begin to shape the future of work. We have a work group that includes representatives from our CHICO, our Chief Human Capital Officers, our Chief Information Officers, CFOs, Real Property and Acquisition Council, to really make sure that we're not trying to develop policy solutions in silos, but we're bringing all of those together on a very regular weekly basis. To be honest, we're meeting with that group to ensure we don't fall into maybe some of the traps of the past, where you can develop a real property policy over here and a telework policy over here, and those things really haven't been connected. So I've been really encouraged to see that sort of whole of government approach that ensures we don't go into a siloed approach. The second big question I have is how do we optimize vertically. So how do we move away from kind of top-down compliance toward opportunities to create bottoms-up feedback? How do we surface the issues that people on the front lines of our workforce are identifying, or our program partners, state and local governments that we inevitably will be partnering with? What are our feedback mechanisms to be sure we're understanding what the challenges are on the front lines, and how do we reposition leadership to be focused to address those and really define leaders' roles in that way? Just giving you another example, very real-time example. Just last week, for the first time ever, the President's Management Council, together with OMB, OPM, and GSA, sponsored the first ever pulse survey of all 2 million federal employees, where we asked them 3 to 4 questions to be able to get real-time feedback for a quick pulse check that can help our leaders directly hear from employees to inform, the administration's actions on how best to support the federal workforce. I think that's one good example of, not waiting for the annual survey, which will still be a really important tool that we'll have, but also being able to more regularly go out and get quick feedback to inform our efforts. The third thing I'd say is, kind of as we better understand how we organize horizontally, as we create better ways to surface vertically kind of feedback to inform decision-making, the third thing I'd add in is, how do we optimize decision-making routines really at all levels with agile policies? We are not necessarily going to get every one of these issues right the first time, but having a way of updating our policies and practices on a real-time basis based on the feedback that we're getting and providing guardrails really for decisions that can be delegated to the lowest appropriate levels in the organizations to provide maximum flexibility for defining work requirements to meet mission and workforce needs is such an important principle. And speaking of principles, I think that's another thing I'd kind of say has been a real important feature of the approach we've tried to take, which is laying out some of those principles. We laid out 4 in June and guidance out to our federal agencies: promoting a flexible and agile workforce, empowering agency decision-making so that we avoid kind of one-size-fits-all requirements, strengthening diversity, equity, inclusion, accessibility in our workforce, and to the point you all were discussing, considering our communities that we work in as part of our future of work planning. So I think kind of keeping things at that level of making sure we're really clear about our values and our principles and our overall approach to management in delegating decision-making, recognizing the wide variety, especially across an organization the size and scope of the U.S. government, of mission needs and unique requirements that exist, and creating an opportunity for that is absolutely critical. And let me just close with complete agreement on the focus on trust. That has been a theme we have seen really become, I think, the dominant discussion in my OECD hat and in that engagement as well. A couple countries have done real deep dives on better understanding what the drivers of trust are. Finland and South Korea in particular have done very extensive surveys of their population. We're trying to learn from that and potentially looking to engage with other countries in a similar kind of exercise to better understand what it does drive people's trust in government, and how do we use that information to focus leadership and managers and others in the public sector on those actions that are going to help improve our trust in government. And if you need a good example in the United States, you don't have to look much further than the work that VA has done, where they've improved their trust with veterans from, I think, around 50% to up to 80% over a few years through their focus on that veterans experience. So it is possible. I am optimistic, and really excited to be joining you all and looking forward to the discussion.
Well, thanks so much, Dustin, for those remarks, and to Don, Rich, and Katherine for your tour de force and walking through a complex purport and subject in a short amount of time. And the last point, I think, is so critical for a number of reasons, not the least of which is that we do have ongoing center research in the area of trust and agility in government that Ed DeSev, the former OMB Deputy Director for Management, leader of the Recovery Act, is leading in his hat as a visiting fellow with our center. So we'll be looking more at this in the future and welcome both these comments and also comments that our participants may share as well. And on that note, we have a question on trust in government, and the question regards the learning from this crisis and how to increase trust in government in terms of specifics. I think you've commented a little on that. I think also an additional part to this question is the trust equation differential depending on what level of government you're at? Are there different levels of action or different types of action at a national level relative to a state or provincial level relative to a local level? You know,
I can kind of answer that with even a little bit of data, but it's a little bit old. There was surveys taken, I think, maybe 3 years ago. Catherine, you can help me here. And I think this was also out of the Pew Charitable Trusts. And it appeared that there was least amount of trust the further away from you the government became. So that people tended to trust small towns much better than they trusted if they were in large cities. They tended to trust their cities better than they trusted their states, in part, I think, because a lot of people don't even know what their states are actually doing for them. And people tended to trust the federal government least of all. So that I know is at least what the Pew survey said.
Yeah, part of that is that at local levels of government, people can really very clearly see what the government is doing for them. I mean, they see the sanitation, the streets either being repaired or not being repaired, the kind of very basic services, not big policy questions, and that kind of, I think, contributes to a higher level of trust when you get closer to government directly serving people that are paying the taxes for.
And if I could just step in and sort of unpack this a little bit more, the fundamental question is, an answer to your query, Dan, is trust really a matter of structure, and therefore local governments, because they're closer to the people, are more likely to do things that generate trust? Or is trust the product of a relationship between those who administer government services and citizens who receive them? I think too often we get hung up on the first and ignore the second. That trust is, I think, much more the product of the relationship between individual citizens and the services that they receive. The OECD's got some great data on this, and I'd like to hear Dustin's comments on this. They got some great data where, in general, trust in national governments isn't great around the world, but there are much higher levels of trust for some services than others, and trust is variable depending on the service. And so what I think we've discovered is not just that local governments are more trustworthy in the eyes of citizens, it's that citizens trust most those services that they have a connection with and feel satisfied by. And that I think opens the door for the federal government to do much better if it focuses on improving that interaction between citizens and government, and to try to engage government employees to try to do that. The more that employees at the federal level are empowered to satisfy citizens, the more likely they are to build trust. And I think this is pretty hopeful, because who wants to be a Fed and sit there and know that nobody's ever going to trust you no matter what you do? I think that's just wrong. I think we have some evidence on that. And Dustin, both from your experience at the federal level, but also what you've learned at the OECD, I mean, what are your thoughts on that?
Yeah, just two quick reactions. Putting my U.S. government hat on, I couldn't agree more. In fact, there are a number of programs. I think we've identified about 33 that have the highest interactions with the public, whether that's your TSAs or student loans or National Park Service or Medicare. We actually have a number of places where the federal government is actually directly interacting every day with citizens, and a large number. So I'd encourage you to check out performance.gov/CX for customer experience, CX. And you can actually see kind of where each of those programs we've identified, we call them high impact service providers, HISPs, are doing and using customer feedback to improve their program operations to better serve the public. And we actually even have some standard questions each are working to adopt in getting that feedback, one of which includes a question on trust. So I think we are actually even starting to see the needle move in the right direction in terms of satisfaction with these services. And I think it's due in part to that effort we've worked on now for a number of years. So I'm continue to be encouraged and optimistic by the leadership support we're seeing for that work, and think we can catch up to our private sector counterparts who have clearly invested a lot more in this quickly. And then on the OECD front, the thing that really struck me is the two things that showed up in both Finland and South Korea were responsiveness and reliability. To your point, Don, around it being actually a little more about the relationship you develop. The responsiveness and reliability in both countries, different countries, both had those same two factors be the primary kind of drivers of whether people, trust their governments. And I think that those aren't words we hear as much as we should in terms of guiding the focus of our program delivery. But I think there's a lot we can learn from that and start building into our program operations.
Thanks, Dustin. And let me use this opportunity to bring in Tim Pados, who is going to be making some remarks in a few minutes in terms of a close, but I know has a lot of experience that's relevant to the current discussion. So Tim, I know you wanted to get in on this.
Yeah, thanks, Dan. I've been chomping at the bit here because in some ways, in my role at IBM, we come at the challenges around COVID from a slightly different angle. We're less about policy, although we're deeply involved in those pieces, and more about the effectiveness of government. But the idea of trust to me is really what this all comes down to, right? You could say people are less trusting right now in their societal institutions in general outside of government. When you think back to things like, the supply chain disruptions that we've had, but in government in particular, and that's driven by policy, but I think it's driven more in larger part by government's ability to meet citizen expectation, right? So when you saw COVID hit, you saw this incredible explosion in the demand for government services. And for many citizens, it was the first time that they were really interacting up close and personal with their government. And what I mean by that is we all go get our driver's licenses and we pay our taxes, and we may pay fees here and there. But for large swaths of the populace in the U.S., but worldwide, you may not have applied for unemployment. You may not have applied for government health care because you just lost your private health care insurance from your job. And these citizens who went to government, under a time of duress, under a time of stress, to ask for a benefit for the first time, their expectations have been calibrated by ordering stuff from Amazon, going to Bank of America and being able to be recognized by Bank of America. If I go to my Bank of America site, all of my account information shows up from different lines of business within Bank of America, my savings, my checking, my mortgage, etc. People are used to, ordering an Airbnb, jumping in an Uber and doing their banking on the way over to their Airbnb. They came to government and they didn't get the same frictionless citizen experience. In the United States, 26 of the 50 states' unemployment systems crashed by April 15th because they were not set up to handle this incredible surge in the transaction load. One is citizens weren't able to access a single website that says, I just lost my job, my mom's in the hospital, what do I do? This gets to Dustin's horizontal integration piece. In the state of Connecticut, where I live, there's 22 different social services agencies, 22. So if I lose my job, why do I need to go navigate and figure out which of these 22 agencies I should be going to? Wouldn't it be great if I could just go to one site, ask a natural language question, and it directs me to the right piece? So that was one piece, the frictionless citizen experience. And then the back piece was the systems weren't set up to handle the transactional load. And so the good news is, and I don't want to shoot all my closing comments here, is that we saw a lot of innovation very quickly in government. I think government leaders surprised themselves with how quickly they can innovate. We saw 10 years worth of innovation in about a 2-year period, right? To really create the frictionless experience and modernize. And that to me gives a lot of hope, because I think many government leaders, we've kind of we've fallen into the trap. Well, we can't innovate as quickly as, the .com companies. Well, we can. It turns out we can. We just need the will to do it. And that's where I think we can do a lot in terms of restoring trust.
Thanks, Tim. And I think your comments echo the hopeful view based on the research and experience from Rich, Katherine, Don, and that Dustin reflected as well. There's a comment that talks about a little bit of the other side of this, which is the information dilemma, where people are, in terms of the trust equation, in addition to receiving services, it's about the information they receive about government and about larger institutions, Tim, as you pointed out, and that information is used to form opinions, and those opinions can get reinforced when information kind of is dichotomous, sort of speaks to one side or another side of an argument, and that can fuel distrust. So can any of the panelists want to unpack? And now we're going to throw it up to everybody, and then Tim will still get to close. But anybody want to take that comment on to start?
Just a quick reaction. Katherine, let me talk to you first.
Wait, Don?
Don, go ahead.
Now, one thing I was going to say is that I think the context for your question, Dan, is so incredibly important. And if you listen carefully and step back and then fly over what we've been talking about from about 50,000 feet, what we're really saying is that if you try to attack big, complex problems that stretch over not only local but national and even global lines, that the idea of approaching it through structures and processes as the core building blocks, that we're going to assign responsibilities, is just not going to work. What really matters is trying to think about new strategies of governance that connect the entire system to citizens where they are, where they sit, at the place where they live, and to try to provide the results that they want in ways that are going to satisfy their needs. And that driving that then has to be the data that you talked about, Dan, that the data become the new language. If you just look at the way in which the little CNN box off to the side of the screen, talking about the number of cases, the number of deaths, the way that drives public debate. If you look at the way in which we've been able to at least have a more informed conversation about the issues of race because of the way in which we've developed data to be able to do that, which we didn't have at the beginning, that we need to think about the structures and processes for sure, but the need to try to drive the connection with citizens through an application of data that becomes the language for focusing what matters.
And why I was pointing to Katherine, and I apologize for cutting you off briefly, Don, but any opportunity I have to put Katherine on the spot is a joyous one. Could you talk a little bit about transparency websites? Because I know you know a lot about this.
Well, we've recently done some columns both for the Government Finance Review, GFOA's publication, and for Route 50, where we're senior advisors and columnists about transparency and about the use of data. And this does seem like a hopeful way of governments just being more clear in what they're doing to communicate with people about it. And but what worries me is the feeling that people don't trust the data. I mean, how do you deal with kind of the wonderful new opportunities we have with developing data and sharing data, and but if people are going to deny it, what then? And again, Don, you have any ideas, or Dustin, about that?
Dustin's been doing this, I know. I'd love to hear what he has to say.
Yeah, I wish I had a great answer on the trust of data question. I mean, my sense is that people are obviously a lot more interested in the closer the data is to their own life experience, right? And I think that we should be taking kind of, as Tim was saying, kind of the lessons learned from some of our private sector colleagues, to be honest, that frankly provide a lot more transparency to people's individual kind of interactions with the company that we don't often give for people's interactions with government services. So we want to talk about data at the macro level. I think you're going to always be limited in how much interest you're ever going to find. But as you start going kind of more granular and more disaggregated, I think then it starts becoming a lot more real, a lot more powerful for people. And I really think, if you can show where people are, for instance, in a process, so they can see on their own, dashboard view of where they stand, it makes a huge difference. And I think gaining people's trust in the process. And we don't always do a good job of, I think, adopting those kinds of really basic practices that now have firmly become the expectations of everyone who interacts with any institutions. And I think there's a lot that could be done in that space as a way of gaining people's trust, kind of one transaction at a time.
Right. And I would add to that. I would actually, let me take a contrarian view here. I don't think it's that people don't trust the data. I think it's because people don't trust the interpretation of the data. And what I would further nuance there is the conflicting interpretation of the data, right? So you can, to Walter's question that's in the chat, I can come up with a conclusion, and I guarantee you I could go out and find the data that supports my conclusion, right? And so that gets to the trust factor, because we hear different leaders saying different things based on the same data. So one way to combat that is to maintain the middle person, the expert who's interpreting the data, absolutely, but provide the raw data to the citizenry so that they can go and play and interpret some of the data themselves, right? There's this natural kind of aversion to letting people look into the data and make their own conclusions and make their own decisions. And you see, if you're on social media, you see memes saying that, like, hey, your 20-minute Google search does not overrule my my 30-year career as an MD interpreting this data. And there's some truth to there, there is expertise. But that doesn't mean that me as a non-MD can't look at the data and draw my own conclusions and kind of check the work of the experts, right? So I think the idea of open sharing of data, open data, transparency can do a lot towards building trust.
Yeah, I think it's definitely a both and resolution. I think Walter's cautions, I think, properly frame risk. But Tim, you're pointing out there's the role, as Don and Rich and Katherine's pointed out, there's the role of experts. There's as Dustin pointed out, there's the role of how that information is communicated to the public, so there's some context. And there's the role of transparency, and it's almost like a three-legged stool. And if one of the legs is missing, you can go into a danger zone.
I'll take that one step further. We talk about citizen trust and lack of trust in the citizens. Provocative statement. How about we also trust our citizens to be able to look at information and form their own conclusions, right? It's a two-way street. And, you can get philosophical about this, but, when the government treats citizens as adults and give them the information and let them form their own conclusion, that builds trust as well.
I'd also just add on to that, thinking about how we strengthen and empower our own workforce, right? And how our rules and processes, that often kind of sets up the context for the interactions between your public servants and the people we're serving, is how they're treated and how they're empowered to make decisions or not. So I think that is another piece of it that sometimes can be overlooked.
Exactly. It's kind of unfortunate we're just getting to this piece with only 10 minutes left, because this is great beer conversation. You can spend hours just on this one.
Mm-hmm. All right. Well, it's a little early for a beer now, but those of you that will be watching this on demand, we welcome you to turn this on at happy hour in your homes and workplaces. What a rich discussion. Rich, Don, and Katherine, any kind of final thoughts before Tim closes? Especially, those from within government who are watching. Is there one or two things they can do to get started? We talked about a lot of different principles and constructs here. How does one start down the road in terms of response and recovery? Maybe a quick exit question before Tim closes.
I'll jump in first and just suggest that, and underline what Dustin said, that what really matters is that every person who works for government can understand how what they do connects to the needs of citizens, and can understand the importance of that front of mind in everything that they do. And that's getting harder the more complex networks get, the harder it is for having anybody be in charge of anything, which is, I think, increasingly the reality that we found. But on the other hand, if nobody's in charge of anything, then everybody's in charge of making contributions to citizen satisfaction. And so empowering employees, engaging employees to try to nurture that relationship wherever they sit in government is, I think, the single biggest takeaway from all this.
I'm going to follow up just picking out the word relationships that Don just used, because the fundamental way that governments work together really depends on the development of personal relationships among the people who are in the governments. And I think that building that in advance is just of fundamental importance, and it's often not there. I mean, and we've seen, looking at different states and their response to cybersecurity, where it works the best is where before anything happens, people know each other and know who to call and know how to work together. So that's what I would point to.
And I would add on to that just the word communications, which is something that was deeply lacking in an intergovernmental way and through different governments at the same level. We interviewed someone, I think it was from Erie County, New York. Katherine mentioned earlier on that the counties were often left out. The folks from Erie County found out what they were supposed to be doing to fight COVID when they heard the governor speak on the TV the previous night, because the communications wasn't there. And I think that this is a really critical kind of an improvement that's very necessary, is for the levels of government and the governments unto themselves talking to one another in language that they can all understand and with mutual respect.
Thanks to Don, Rich, and Katherine. Dustin, any last word before we turn it over to Tim?
No, this has been a great discussion. I think we've covered the landscape pretty well here, and really appreciate being part of it. And look forward to continuing the discussion and Tim's comments.
Okay, well, thanks to you, to Don, Rich, and Katherine for your very insightful report, to all of you for your leadership in the public and private sectors. And it's an honor now to turn it over to Tim Pados, who will deliver some closing thoughts. Tim?
Thanks, Dan. I don't know how much of an honor it is, but I'll tell you what, it has been an honor to be to join this and just listen to and interact with Don and Dustin and Katherine and Rich, the husband and wife team. You can only imagine what conversation around the dinner table is like with Katherine and Rich. It was truly an honor, very informative, very insightful, but most importantly for me, it's validating because my team, global government team at IBM, is out in the trenches every day working with government agencies from across the world. And so I don't have a lot to add, but I would like to tease out just some themes that I've noticed and that's validated by this report. So we talked a lot about trust, right? And that's a central theme. One of the things that I think that COVID really revealed is how interconnected and integrated the world has become. And as we've moved to become interconnected and integrated across the world, we've created this rigidity and fragility that was really underscored by COVID. What do I mean by that? If you just look outside government for a second, just think about things like the supply chain. Now, everyone had their experience when COVID first hit about going down to the grocery store and not being able to find toilet paper, right? So we all have our personal experience, whether you couldn't find toilet paper or poultry or whatever it was. The problem wasn't that the world ran out of toilet paper. The problem was that 65% of all the paper products that are produced are delivered to the industrial and the recreational supply chain. What I mean by that is they're delivered to hospitals, hotels, office buildings, etc. And they're delivered in the big cardboard boxes, and it's that cruddy, one-ply toilet paper, right? Versus only 35% is delivered to the consumer supply chain. The problem wasn't that we didn't have enough toilet paper. The problem is that we'd had too much toilet paper in the wrong channel of the supply chain, and it was not flexible and agile enough to shift that production and shift that packaging down to your local Piggly Wiggly or your local Stop and Shop, right? And so that's a great example of fragility, and the rigidity of some of our institutions. You looked at poultry at the same time that we're running out of toilet paper. The Poultry Association was throwing out 3.5 million eggs a day at one point, because again, the eggs were going to the restaurant supply chain versus the consumer supply chain. So what we need is to really think about how we create flexibility, agility, and the ability to respond to whatever the next crisis is, whether it's a next pandemic or some sort of climate disaster. Who knows? Godzilla. But we need to take the learnings from COVID and deliver it forward. So the four themes that we saw is we talked about citizen trust. Citizen trust is absolutely essential, not only for the effectiveness of government, but really for global stability, right? So citizen trust became a critical issue to provide services and keep the economy going while balancing protection, personal liberty, and equity. Second theme that I saw is that, hey, many governments were caught off guard. Heck, we all were caught off guard when COVID hit. But I think government leaders really surprised themselves in terms of how quickly we could move things and make things happen. Again, we saw 10 years worth of innovation in terms of citizen experience and modernization and creating flexibility and agility, 10 years in about a 2-year period. However, we did a lot of things in the heat of the moment that we had to get done very quickly. And so maybe we didn't pay as much attention as we could to governance and management. We did a lot of things very quickly, but we didn't put a lot of governance over it. If you just look in one area, for instance, cybersecurity, we did a lot of things we needed to do in the heat of the moment, and maybe cybersecurity wasn't prioritized at the highest level that it should be. So now we've got to go back and, how do we maintain this flexibility and agility and this innovation, but put some governance and control over it so that when the next thing happens, we don't get in trouble. And then the third theme that I would hit, and Dustin touched on this briefly, we kind of got towards it in the end, is the idea of the future of the workforce, right? Government has transformed. It is transforming. As governments adapt, as we all as citizens adapt to this new normal, the new world, the government workforce needs to adapt as well. And there was a report by the World Economic Forum that said 50% of workers are going to need to be reskilled by 2025. These are the folks, the case managers in social services agencies that now need to work horizontally versus vertically. These are the folks delivering PPE, whatever it is, they need to reskill. But there's so much pressure on government right now that we can't pull people out of the field to retrain them. We've got to give them new ways of learning and adapting in line with the work. So those are the three big things I see, citizen trust, innovation with governance, and how do we reskill for the next decade. So with that, Dan, I'll leave it to you.
Well, thank you, Tim, and what a terrific discussion. We will continue the dialogue both with our outstanding panelists and discussants today, as well as with all of you, whether you're watching now or whether you watch it in coming days, weeks, or months. And the Center will continue our research program, looking at all of these different questions, looking at trust in government. We have another, speaking of supply chain, another report that we're doing with one of the leaders in sort of global supply chain research around government, Rob Hanfield from North Carolina State. So stay tuned for that. And thank you all for joining. Thanks especially to our panelists. And of course, thanks to Ruth Gordon, who has been the master for us all behind the scenes in making this possible. Take care. Have a good day.
Thanks, Dan.